For a few years, we've been covering the weight loss success local people have been having with those injections that curb your appetite.
And on tonight's Weight Loss Wednesday, medical reporter Meg Ferris shares the latest finding on those medications. A new study suggests there is a positive benefit when it comes to having thoughts of suicide.
As more people use those injections of semaglutide and tirzepatide for weight loss and diabetes blood sugar management, doctors are finding obesity is just the beginning of what they treat. You may remember a finding of 20% fewer heart attacks in people at risk. And because they work on the reward center of the brain, people report improvements in behaviors like decreases in shopping, nail biting, gambling. People reported less interest in drinking alcohol, and they decrease the chronic inflammation throughout the body.
Of course, they improve insulin sensitivity, and now we know they're related to not just hunger, but fullness and how quickly our stomach empties, and now inflammation, and probably more we'll find out in the future.
So we asked medical director of the Tulane Weight Loss Center, Dr. Levy, to explain the latest finding by the National Institute on Drug Abuse, that these injections are associated with a 49 to 73% lower risk of first-time or recurring suicidal thoughts compared to other medications for controlling obesity and diabetes.
I will say that these results are more consistent with what we've seen in our patients, that people feel happier.
Dr. Levy says something major she sees in patients is a quieting of the food noise, those intrusive thoughts in your brain about eating food. She says some patients even report a mood change, experiencing more euphoria when they use semaglutide. Dr. Levy cautions that this latest study was not long-term and one that observed patients rather than use control groups. So more studies are needed for complete answers of the hows and whys with the suicidal thoughts. But the science is much more clear when it comes to causes of obesity.
I think we're better understanding that this is a hormonally driven disease. GLP-1 levels are generally low in people with a disease of obesity. And so if we can raise those levels, we can then start treating this disease.
For Weight Loss Wednesday, I'm Meg Ferris.
Dr. Levy says because we are still learning so much about these injections that you should always be monitored by a doctor when you're using them.